you ever left a doctor's appointment with more questions than answers? Managing diabetes can feel overwhelming, but today we're tackling the most asked questions from real people, people on social media, patients that I've had conversations with in the past throughout my professional career, and just folks in general. And we're talking about diabetes and what to ask your provider. In this channel, I help you gain the confidence and clarity you need to manage chronic conditions like diabetes so you can live that healthier life. Let's dive into the top questions you should be asking your healthcare provider. Welcome to Empathy in Practice. I'm Florence. I'm a family nurse practitioner, and I've had many years of experience in ICU nursing as well as nurse case managing, advocating for patients with complexities of their diseases, as well as guiding them through the confusing and frustrating experience in the healthcare system, as I'm sure every single one of us have had to experience at some point in our lifetime. So in this channel, I help you navigate chronic conditions by breaking down complex health topics and empowering you with practical advice. If you're living with diabetes or supporting someone who is, these questions are going to help you get the answers that you need from your healthcare provider. Now, while there are many diabetes management programs out there that your provider can refer you to, engaging directly with your provider is still very impactful, and it's so important because it helps create a plan that's uniquely tailored to your needs and goals and lifestyle. As you know, we're all very different. We come from different backgrounds, different lifestyles, different cultural preferences, and just different chronic conditions and comorbidities in the first place. And your provider can monitor your progress, they can adjust treatments, plans as needed, and answer your specific questions, which means that you're not just following a general program, but also receiving that personalized support. And this relationship can make all that difference in keeping you motivated, informed, especially, and on that right path towards being able to manage your diabetes and a better health. As a side note though, this video asks questions for someone with diabetes. However, if you've been told that you have pre-diabetes, this is going to give you insight on what to expect if you're teetering on becoming diabetic. And by the way, a pre-diabetes video will follow this one, so if this is you, you'd want to stay tuned. Question 1. What are the early signs of diabetes I should look for? So talk to your primary provider about the early signs, things like high blood sugar, like frequent urination, increased thirst, and unexplained fatigue, just feeling so tired and out of sorts all the time. It's important to know what steps to take if you notice these symptoms, and having that conversation with your doctor about these steps is key so that you don't get into those complications, and rather you're staying ahead of it. Question 2. How can I effectively manage my blood sugar levels? Well, keeping your blood sugar stable is so important because it helps you avoid those highs and lows, that you can feel whenever you have these symptoms. You feel tired, you get dizzy, and sometimes it even impacts your mood and focus. And over time, uncontrolled blood sugar can lead to complications like heart disease, kidney issues, and nerve damage, even eye damage. So ask your doctor about specific strategies tailored just for you, things like being able to manage your carb intake, setting up an exercise routine that fits your lifestyle, and also knowing how to manage your medications effectively. And these small, consistent steps can make a huge difference in protecting your health and helping you feel your best day to day. So again, knowing the signs and symptoms of high blood sugar and low blood sugar levels and knowing how to manage those when you're at home is so important to talk to your doctor about. Question 3. What should my diet look like for diabetes management? Well, many people wonder about the best diet for diabetes. Ask, are there specific foods or meal plans that I should be following? And your provider can help you create a diet that works with your blood sugar needs. Question 4. What's the difference between type 1 and type 2 diabetes? Now, this is a question that's often asked and one of the most common questions actually is, what is the difference between type 1 and type 2? Well, in type 1, the body can't make insulin at all, which usually requires that lifelong insulin therapy. And in type 2, the body doesn't make insulin well or doesn't make enough of it. And this type can often be managed with lifestyle changes, medications, and sometimes adding on insulin. So it's important to understand how your specific diagnosis affects you, because treatment and management plans can vary a lot between the two. So ask your doctor to explain how your type of diabetes impacts your body and the best ways to manage it. And knowing the specifics can also empower you, obviously, to make informed decisions and take an effective role in your care. And to note, type 2 diabetes is more common in the older adult population, rather, not older, but adult population. But now more and more the lines are blurred, because it's coming out that younger and younger folks are being diagnosed with type 2 diabetes. So knowing what type of diabetes you have is important. Question 5. What complications can diabetes cause, and how can I prevent them? Well, diabetes, if it's not managed well, can lead to serious complications like heart disease, like I've mentioned, nerve damage, kidney issues, and vision problems. And that's why it's important to talk with your doctor about what risks you might personally face and how to prevent them. So ask them to go over the specific complications you're at risk for and discuss preventive steps like regular screenings, which is so important, lifestyle changes, and any necessary medications. Now, going back to the regular screenings, I'd like to talk a little bit more in depth about this in the next video, but in general, things like diabetic eye appointments, doing that every year if you're diabetic, is one of the more important screenings that you can do as well. Now, taking these proactive steps can really make that difference in protecting your long-term health and keeping you feeling your best. Question 6. How does diabetes affect my mental health? Well, living with diabetes doesn't just impact your body, it can take a toll on your mental health too. Managing your blood sugar, planning meals, staying on top of appointments, and don't forget, managing your diabetes blood sugar levels in terms of knowing when and how often you should be checking your blood sugars. It's a lot, and it can lead to stress and anxiety and even burnout. So ask your doctor, how does diabetes affect my mental health? And they can help you understand why you might be feeling this way and discuss ways to manage it. See if there are any support groups, any counseling options, or stress management resources available, because addressing the mental side of diabetes is just as important as managing the physical, and having these resources can make that huge difference. Question 7. What are the latest advancements in diabetes treatment? Now, diabetes care is constantly evolving, and new treatments and technology come out all the time that could make managing it a bit easier. So ask your doctor, well, what's the latest advancements in diabetes treatment? They might tell you about the new medications available out there, new insulin delivery methods, or even the latest in the continuous glucose monitoring that can track your blood sugar in real time. So staying on top of these options means that you might find a tool or treatment that fits your lifestyle better, and it improves your overall management. So it's all about finding what works best for you as new options become available. Question 8. How can I support a loved one with diabetes? Now, if you're a caregiver, this question is so important. So ask for advice on how to offer that emotional support, helping with a meal prep or monitoring their health together. And there you have it. 8 essential questions to ask your provider to feel empowered and informed. Remember, in this channel, I help you take control of your health by guiding you through questions and strategies that make a difference. Ultimately, I'm always going to advocate for lifestyle changes, because by far, this alone can vastly improve your diabetes and your health in general. So if you found this helpful, please hit like and subscribe, and drop a comment with any questions that you'd like me to cover or any topics that you'd like me to cover. Or I would actually really like to see what kind of questions you feel should be asked that's not listed here. and any experiences that you've had with your primary physician. Again, thanks for watching, and see you in the next video where I go over the top 5 questions to ask your doctor about blood sugar monitoring as well as pre-diabetes. And with that, friends, I hope you are doing well, and we'll see you again in the next video.